5 medical screenings to reconsider after age 60, an evidence-based analysis. In modern medicine, more testing does not always equate to better health. A growing concern among medical experts is overdiagnosis, the detection of abnormalities that would never have caused symptoms or death, leading to unnecessary and potentially harmful treatments. Below are 5 common screenings for seniors that recent scientific data suggests you may want to skip or discuss deeply with your physician. Full-body CT scans, often marketed as a proactive wellness check. These scans are rarely medically necessary for asymptomatic individuals. The scientific evidence, according to the National Cancer Institute, NCI, a single full-body CT scan exposes a patient to 10 to 30 MSV of radiation, roughly 100 to 300 times the dose of a standard chest X-ray. For seniors, whose cells are more sensitive to DNA damage, this significantly increases the long-term risk of radiation-induced cancer. The risk of overdiagnosis. A study in JAMA Internal Medicine found that over 30% of scans pick up incidentalomas, harmless nodules or cysts. This triggers a medical cascade of invasive biopsies and anxiety-inducing follow-ups for conditions that were never a threat. Source: American College of Radiology, ACR, or White Paper on Incidental Findings. Routine annual EKG, electrocardiogram, for patients with no history of heart disease and no active symptoms, like chest pain or palpitations. The annual EKG may do more harm than good. The scientific evidence. The U.S. Preventive Services Task Force, USPSTF, issued a D rating for EKG screening in asymptomatic, low-risk adults, meaning there is no net benefit. The risk. EKGs in seniors often show minor abnormalities that are common with age but clinically insignificant. These false positives lead to unnecessary specialist referrals, expensive stress tests, and even invasive cardiac catheterizations that carry their own surgical risks. Source: Annals of Internal Medicine, Screening for Cardiovascular Disease Risk with Electrocardiography. PSA testing for men over 70. The prostate-specific antigen, PSA, test screens for prostate cancer. But in older men, the harms of screening often outweigh the benefits. The scientific evidence. A landmark 15-year study published in the New England Journal of Medicine, NEJM, compared aggressive treatment to active monitoring for low-risk prostate cancer. The results showed nearly identical survival rates between the two groups. The risk. Many prostate cancers in men over 70 grow so slowly they will never cause symptoms. However, a high PSA leads to biopsies, risk of sepsis, and surgery or radiation, which can result in permanent urinary incontinence and erectile dysfunction. Source: USPSTF, Screening for Prostate Cancer Recommendation Statement. Annual Pap smears after age 65. If a woman has a consistent history of normal results, continuing cervical cancer screenings into her late 60s is no longer recommended. The scientific evidence. The American Cancer Society, ACS, and the American College of Obstetricians and Gynecologists, ACOG, state that women over 65 who have had adequate prior screening, 3 consecutive negative Pap tests or 2 negative HPV tests in 10 years, can stop screening. The risk. Cervical cancer develops very slowly, often taking 10 to 20 years. Testing in older women with a clean history is more likely to yield false positives due to age-related hormonal changes, leading to unnecessary and uncomfortable procedures like colposcopies. Source: ACOG Practice Bulletin No. 168, Cervical Cancer Screening. Carotid artery ultrasound. This test uses sound waves to check for blockages in the neck, arteries to predict stroke risk in people without symptoms. The scientific evidence. The USPSTF strongly recommends against this screening for asymptomatic adults. Research shows that the accuracy of the test is low in the general population, leading to many false positive results. The risk. If a blockage is found, patients are often steered towards surgery, carotid endarterectomy. For someone without symptoms, the risk of having a stroke during the surgery is often higher than the risk of the Blockage ever causing a stroke? On its own. Source: Journal of the American Medical Association, JAMA. Screening for asymptomatic carotid artery stenosis. Summary table: what to prioritize instead. While the tests above are often unnecessary for healthy seniors, the following are backed by strong evidence.